Hello, my name is Dr. James Daniels, and I'm addressing you, the other members of the Department of Anesthesiology, as well as hospital employees and administrators. And I'd like to talk to you today about a product called the McGrath Video Laryngoscope. Give me a moment to share my screen. Okay, so the McGrath Video Laryngoscope is a portable handheld device that's been shown to be as useful in dealing with patients with difficult airways. For those of you who are not familiar with what airway management is, I'm going to show you the next slide. So here we have an anesthesiologist doing a standard laryngoscopy with a laryngoscope. He's placing an endotracheal tube into a patient's trachea. So now this is done with this. This is what a laryngoscope looks like. It's placed into a patient's mouth. It has a light. It's used to guide an anesthesiologist as he places an endotracheal tube into a patient's trachea. 9 times out of 10, this is sufficient. This is done for general surgery or even some emergent situations. But in the case of a difficult intubation, something more may be needed. So you may be asking, what makes the intubation difficult? Let's say a patient is morbidly obese. They have a high BMI. Let's say they have an anatomic abnormality of their head and neck. What if it's a trauma or emergent situation where they're bleeding from their face? Or what if in the case of COVID-19 or respiratory syncytial virus, where the anesthesiologist or provider wants to take some infection precautions and create a little distance between him and the patient? In these instances, video laryngoscopy is preferred. Here's an example of a McGrath video laryngoscope. This is what it looks like. So you've got your screen here, you've got your light here. So as opposed to the standard laryngoscope, this is done the same way, except you're able to look at a screen, thereby creating a bit of distance between you and the patient. This has been shown to have a lot of clinical benefits. One such benefit would be is that it shows an increased success on the first attempt at intubation. A study done in the British Journal of Anesthesiology showed that the first attempt with a McGrath video laryngoscope was far outweighed doing an attempt with a standard laryngoscope. And it was also shown that this had a decreased likelihood of traumatic injuries as well. Another clinical benefit would be better hemodynamic response. For those of you in the audience who may not be familiar, patients who are getting intubated, it's very common for them to have a drop in their blood pressure and an increase in their heart rate. A study done in the Turkish Journal of Anesthesiology and Reanimation showed that the use of video laryngoscopy showed a far less increase in heart rate as opposed to normal laryngoscopy. So those of you like myself who were on the front lines during the COVID-19 pandemic, you can attest to the utility of video laryngoscopy. So those of you who may or may not know, the COVID-19 virus does cause a drop in blood oxygen levels, often necessitating intubation. And because the virus is spread via respiratory droplets, the process of intubation can place healthcare workers at risk. To address this issue, the Society for Airway Management released a statement showing that they recommend video laryngoscopy as a first-line strategy, thereby decreasing risk to healthcare workers and increasing the rate of success, thereby preventing further morbidities and insult to patients. So how much is this going to cost, right? I'm sure that's what we're all thinking. So the disposable blades that come with the McGrath video laryngoscope actually are pretty comparable in cost to the standard blades that you see in normal laryngoscopes. They're about $10. If these blades were purchased in bulk, they can be bundled for a discount. The handle forever for the McGrath is about $1,250. Again, this can possibly be bundled if multiple people go in, but I'm sure many of you are thinking that's fairly costly. But before you think about that, there's something I'd like you to consider. What are the cost-saving measures of using video laryngoscopy? What about hospital length of stay? What about complications of admission? These instances are far greater on patients who have had difficult intubations. A study done in clinical economic outcomes and research showed that there's as much as a $10,000 increase on patients who have had difficult intubations. So the cost of using this McGrath handle may seem a bit daunting, but if you think about the amount of patients who can come through a hospital and possibly have these complications, I would say that the benefits far outweigh the risks. So it's worth it. In my opinion, it's worth it. We have a portable handheld device, which has been shown to save lives, improve clinical outcomes, and save money. And it's been endorsed by major societies. So it seems like a no-brainer to me. So I thoroughly endorse this product, and I'm happy to answer any questions. Thank you.